your issues are not your physical ones. Your issues are deep, and you need to recognize that. And that was literally the last procedure I had. That sixth procedure in Chicago. I didn't have any more. I mean, it wasn't an instant thing, Mark. It's not like I just stepped away and said, "All right, that's it. I'm done." But I reflected on it, and that was it. That was the turning point. That was the point at which I realized I could control my destiny by focusing on rebuilding what was inside instead of focusing on trying to be this guy that I used to be.
Today's guest is Terry Healey, a man who turned unimaginable loss into a message of resilience. He lost half his face to cancer, endured 30 surgeries, and yet, when you sit with him, what you notice most isn't his facial difference, it's his warmth. I was struck by the moment he described kids no longer staring at him in public, not because they changed, but because he did. In our conversation, Terry shares the tough feedback from a former romantic interest and fellow patient that changed his life, why gratitude became his survival kit, and how running shirtless symbolized liberation. His story is about healing, identity, and the freedom that comes with acceptance. Let's start the show. Terry, welcome. Thank you for coming on. Welcome. And how are you doing today?
Doing great. Thanks for having me, Marcus.
So I want to launch off for the benefit of the audience who are viewing and those who are listening. I want to just kick off. If you can reframe, or let's at least set the table, what happened in 1984. And I think that'll set the backdrop for your book, the Resilience Mindset, which we're going to dive into, as well as your prior book and some of your speaking engagements. But can we kick it off in 1984?
Yeah, 1984. I was a junior at UC Berkeley. I was living life, as I say, on Easy Street. All was going great. Out of nowhere, this bump forms behind my right nostril. I ended up spending a lot of time trying to figure out what it was. They couldn't figure it out. They thought it was a pimple. They finally got the diagnosis. I'm grateful that they got the right diagnosis because it's an incredibly rare form of cancer called a fibrosarcoma. Typically doesn't occur in the head and neck area like mine did. So blessed for that. They took care of it. I was basically back to normal after surgery. They said, "Oh, I think we caught this in the early stages." But 6 months later, Marcus, is when the tingling sensations started, and I started to feel things. And that's when I went back to UC San Francisco and ended up having an incredibly serious situation on my hands that I had no idea was coming, which resulted in a surgical procedure 10 and a half hours long, where they removed, half my nose, the shelf of my right eye, the muscle and the bone from my right cheek, part of my upper lip, part of my hard palate, and 6 of my teeth. And I woke up attached to my chest because they had transplanted this full thickness skin graft from my chest to fill in this cavity that had been created on my face. And so
it means to increase blood flow there,
yeah,
right? To stimulate growth.
Yeah, it was, it needed its own blood supply in order to transplant that tissue because it was such a serious defect, such an intense defect. So my story then becomes, well, it's a life-threatening cancer, but it's also disfiguring, right? So that's when I started kind of trying to deal with all of that and absorbing all of that at one time.
So there are so many things I want to ask you, and especially with respect to your support system, sort of rebuilding yourself. But at its core, I think what I was so struck by in your story is this. I have found this very common among a lot of guests on this show, a lot of high achievers, many of the people I respect, which is that I don't know if it's hitting rock bottom, but it is a complete evisceration of who you thought you were. Whether that, and seldom, if ever, have I encountered it where is purposefully done that. It's something that has been inadvertent, something that's been outside of your control. And by virtue of being outside of your control, there is an element of, it's not quite detachment, but it's almost of foregoing the inevitable, something that you can no longer, you can only control how you're responding to it, but the force is so great and so beyond what you can control. You simply have to respond to it. You cannot influence it. And in your book, you talk a lot about the rebuilding. I want to talk about ReBAR and sort of your framing, because I think it's a really interesting distillation of what I think in some ways it might be like a different interpretation of maybe the 7 stages of grief or 5 stages of grief. I think there's some relationship there. But to some degree, and I don't want to put words in your mouth, I couldn't help but think as I was reading, it was a little bit of the death of your former self. You viewed yourself as having success at the bars with women, and having been viewed a certain way, and certainly that influences your ability to view yourself. But what really the bottom line question to me is, and I'd like to explore this further, how do you identify what is at the core and noise versus signal, right? Because when you've been completely obliterated from who you used to be or who you viewed yourself to be, you have to sort of pick up the pieces from inside out. And if you're fortunate, like it sounds like you were in many cases, by having a good community, having a faith-based system to allow you to restore, in some ways, creating blood flow to your face is a little bit of an analogy of maybe the resupplementation of your own source of life, so to speak. But how do you start that? How would you advise someone who's had the wave just completely knock them on their ass? Where do you start?
Well, I often talk about my survival kit, Marcus, and for me, that was really what helped me through the day-to-day ordeal of what I was dealing with, which was really relying on this foundation of faith that I had. It gave me courage, it gave me strength when I prayed. I also practice gratitude, though, right? And I think that that's a really important element. I think a lot of people get into a mode of why me, and they experience a lot of emotions that make it difficult for them to make progress. Totally natural, right? And we should all embrace our emotions, but at some point, you also have to step back, I think, and say, hey, wait a second. There's a million things left that I can do that I should be grateful for. It could have been worse. I mean, if you've read my book, you know that I was really concerned about losing my eye. That to me was the biggest thing with my face that I didn't want to lose. That function was so important to me. And so I was grateful for that, right? Despite whatever else happened. But I tried to hone in on things that I was grateful for. And I think that puts you in a positive mindset. And it makes everything a little bit easier to cope with, to keep hope, right? And when you're positive, and in my case, when I had prayer and faith, I think those things combined gave me a lot of hope. But let's be real here. It wasn't just me. It was, as you alluded to earlier, it was a lot about my support system. I had incredible people around me. I also had the ability, fortunately, to reflect and take note of conversations I had, take note of things people said and did, and try to reflect on those and try to learn from them. And so, I think rock bottom was something that I never anticipated coming, as you say. It sort of came out of left field, but again, something that I was grateful for. So there's a whole bunch of things, right, that I employ in my survival kit. We talked about a couple of them, but I was also somebody that's very focused and goal oriented. That helped along the way to help me rebuild confidence. I was somebody that focused on balance, having outlets, things that help me cope day to day, get the stressors off me, work out in the morning, play guitar at night, whatever it was to get my mind off the anxiety that I was dealing with, right? Group therapy was big, and positive imaging was big for me. So a lot of these tools combined helped me really get through it.
The idea, I mean, look, you were 20 years old at the time, right?
Yep.
When this first happened, and you had 30 surgeries over 7 years, correct?
Correct.
So that's not just faith, that is prolonged, disciplined faith. How do you advise people maintain that? Because it's beyond just energy, right? I mean, I can only imagine, and I don't want to put words in your mouth, but if I were in those shoes, I I know for a fact there would be multiple days, if not weeks and months consecutively, where I just would think, is what am I doing? Is this worth it? I guess what alternative do I have? But to maintain the positivity that on the other side of this there will be prosperity, and even to potentially find joy in that situation. Do you have feedback
Yeah.
on maybe how we can apply that into less dire
Yeah.
situations, right? Where we can implement a more sustainable form of input, contributing to our own perceptions of the reality we're given, so as to generate greater experiential value in those moments and onward,
Yeah.
to build on top of it.
Yeah. So don't get me wrong. I struggled for those 6, 7 years that you referred to, right? I think things got worse and worse for me because I kept having surgery to reconstruct my face. That was the attempt to bring it back. I had this, not a promise, but uh, hopeful words from my main surgeon that was, we're going to get you cured of this cancer and we're going to get you reconstructed back to who you were before. I'll tell you, that gave me hope that was really important for me during that time frame because I kept believing that, okay, I'm going to get through this, even though I'm feeling worse and worse and worse about who I am as a person, my identity. My self-confidence and self-esteem was deteriorating. I got to the point where I didn't want to go to those bars anymore at all, right? It wasn't a fun experience. I avoided small children and groups because it made me uncomfortable. But I think that I was fortunate to, as I said, have people in my life that spoke certain words, said certain things that kept me on track. Um, but it was really a blessing that came at the end of reconstruction from someone who spoke pretty tough words to me about my weaknesses that really highlighted that, wow, this isn't about, I don't have any control. You mentioned this, right? I didn't have any control over this reconstruction. I didn't know what the outcome was going to be. What I could control was what I identified from that conversation, which is that I had to
Yeah.
rebuild from the inside out.
Well, let's talk about that. I think that's Dina you're
Yeah,
referring to,
exactly.
right? So share that story because I think feedback is a gift, despite the fact that sometimes we may not be ready to
Spot on.
receive it. So can you share with the audience what that conversation, how you met Dina,
Yeah.
how that relationship unfolded, and then what was unearthed
Yeah. So this is at a
from her?
stage in 1989. So 4 years after that major procedure that I talked about, I was going back and forth to Chicago to have a series of 6 reconstructive procedures from the best nasal reconstructive surgeon in the US, supposedly at that time. I went back there on the 6th procedure expecting everything to come together because I really didn't look very good going into that procedure. And I thought, okay, I guess it's all going to come together this time. Well, it didn't. And when I looked at myself in the mirror when they, took the bandages off, I was devastated actually. I was just thinking to myself, oh my God, what's happened here? And just fortuitously, I was walking down the hallway of my room. I was all alone, right? Because I was in a foreign place as a 25-year-old. I was by myself in Chicago having the surgery. And here comes this girl the other way. She's in there for cervical cancer, but her prognosis is really good. She smiled and we started a conversation. Long story short is that from that hospital stay, over those next few days while I waited for things to heal and she stayed in there, we got to know each other really well. And she showed an interest in me that I hadn't felt from a female in years. Honestly, I'd never believed I could find somebody who would be interested in me. She ended up taking this interest. We began to see each other. She comes out to California. We go up to the Napa Valley for a long weekend. And I'll never forget the winery we're sitting at, Marcus, and we've got our glasses of wine. We're looking at each other. And she just looks at me and she says, Terry, you have a lot of issues that I can't help you with. You need constant reassurance. I can't give it to you. And that was the light bulb, right? I mean, obviously it was devastating. But it was the light bulb that went off at the end of that weekend that made me reflect and start to think about, how am I going to move my life forward? And I realized right then and there that I couldn't control this surgery. I had to focus on rebuilding from the inside. And so that was a complete about face, right? I took a 180 and said, I'm done with surgery. I'm moving on to rebuild myself. How am I going to do it? I don't know. I over time kind of figured out, maybe I just need to talk to people. Maybe I need to go to group therapy. So that was kind of the beginning for me of coming back up the other side of my downfall.
There's this practice that the Stoics would use, where they would wear threadbare clothing during certain stints to assimilate more into the homelessness community, or to appear in a certain way. And it's not the same thing as what you went through, but it was sort of functions in the same way. I don't know if you're familiar with the concept of memento mori, which is that remember, we will die. This idea of what you have. And I think the exercise in itself, by practicing the exclusions that you might endure by being in public, viewed in a different light, you end up developing a different relationship with the externalities and how others perceive you, in what role and value you ascribe to those perceptions and that feedback. And I think about this from the lens of even a dad. I've got a 3-year-old, and he's still very young, but he's just now starting to understand and experiment a little bit with public perception, how people are seeing him. And I'm also seeing a little bit of an embarrassment when something happens, a shyness. He doesn't like being made fun of, right? These little elements. And, that's the chipping away of innocence in a lot of ways. And it's the reality of the world. But I am very conscious of how because, and follow me here, I know I'm digressing a little bit, but my thought process here is, as I'm viewing him, one cannot teach something you haven't mastered yourself. And so I'm looking at him and I'm thinking, how do I instill a sense of indelible internal fortitude that is impervious to at least negative outside perceptions without invalidating them altogether? Because there are some external validations. Who doesn't like having the attention of someone that's interested in you, or having success in business where the attraction to your charisma or personality, it can be really addicting. Those can be valuable, but by that same token, if you start to determine your self-worth from that, it becomes a slippery slope, a tiger's tail that you can never really get off, because then you fear being eaten by the tiger once you fall off, right? And so, in some cases, what I think happened to you was extraordinarily unfortunate. But by the other side, I find myself really appreciating the opportunity you had to rebuild from such a soulful, intrinsic place. And so, from the lens of a dad looking at a son, you looking at yourself at 25 years old, which, to be honest, you're still a kid, in a lot of ways, 25. I can only imagine what your parents were thinking while you were having to navigate this and find your own footing, because to happen in 20, the delta between who you are at 20 and 25 is pretty staggering. Not just the fact that it's a 25% increase in your age, but those 5 years are really significant in how you develop as a person. And this will segue into identity and purpose because I want to talk about that as well. But how do you view that from, you know, somebody who's experienced it, come out the other side, has developed a new perspective, have received input from somebody like Dina, and then having a successful long-term marriage from a woman who's been a godsend to accompany you, in the journey that you're going through. How do you rebuild from that point? I mean, do you have advice to your younger self on what to focus on
Yeah.
and how to avoid those elements you shouldn't be focusing on?
Yeah, I mean, I think that first of all, I would say, to I say this to a lot of people, is embrace change, because it is constant in life. You're going to have issues that are going to just come your way that you have no control over, and your life is going to get moved and shifted based on those things that happen. And you've got to learn that. If I look at my life, because it's been 40 years, I would say that that trajectory of how my life has gone has been upward, right? But changes along the way uh, make you kind of step back a little bit and regroup and restart. And so, it's kind of like a stock chart in a way. There's upward momentum, but there's sort of some spikes down as you absorb and digest that. But I will say that every change I've ever encountered, professionally or personally, has resulted in improvement in my life, greater happiness, uh, greater purpose. And so part of it is just allowing yourself to naturally absorb things and sort of live with who you are, because you got to be, authentic to yourself. But there are a lot of tools. I think we all have that capacity to build resilience, and it's not that any one thing is going to derail us. We just have to that positive. I keep going back to the positive mindset, because I think that when you start with gratitude, uh, everything becomes better. But no doubt what you're talking about with your son and stuff, and you start to see little things chipping away. I talk about that in the book, right? Where kids are tough, and you get criticized, and things happen to you where it starts to chip away, and you don't really realize it, right? So I think it's great. You're a great dad for being perceptive and watching those things. And I think because of that, as a parent, you have a very important role to play in helping shape this boy in the future. You're his support system, right? He's lucky to have you, and I think that we can't just do it on our own. So I think that your ability to be perceptive and help him along the way is what's going to help guide him toward more success and self confidence and self esteem. If that answers your question.
It does. I want to use it as a springboard about because you're alluding a little bit to progress and future and sort of the stock value going up. And you mentioned something which reminded me of a quote, a Tao Te Ching quote that said, "When I let go of what I am, I become what I might be. When I let go of what I have, I receive what I need." And I want to go to some quotes in your book about that very specific thing about and I appreciate you bringing up this "Be Yourself, Future Self Now" by Ben Hardy, who I got a lot of value out of that book as
Yeah.
well. And it's talking about your future self. I'll read this in a second, but at its core, I think it's talking about purpose and identity and how related I think those things are. And um, I think having a more fluid identity as it relates to a non-attachment to, I felt I've gotten stuck when I became too affixed to the identity I had at the current moment rather than being open to developing the identity I'll become. And when that identity I'll become starts to become a little bit more nebulous, although not lacking clarity, it is something a little bit more into the future. It gives me a little bit more freedom to sort of adapt and negate different parts of, not to be too attached
Yeah.
to these characteristics that we
Right.
have. So let me just read this, and I want to get your feedback here. But having a purpose may indeed be the secret to having a longer life. In his book, Be Your Future Self Now, Dr. Ben Hardy shares some interesting data. Quote, having purpose can prolong and sustain life far beyond seemingly natural life expectancy. In the 18th century, the average life expectancy in America was less than 40 years, yet most of America's founding fathers at least lived at least 20 years longer. Several, including Ben Franklin, Tom Jefferson, John Adams, lived into their 80s. That would be like three friends living to age 110 today, when 75 is the current life expectancy. Purpose provides an unparalleled life force, vibrancy, and zest. You also highlight that openness leads to hopefulness. So I think those are related, the openness and hopefulness. But I wondered if you can just sort of bring us into your world of how you defined purpose and identity and how you used that.
Yeah. So I think as I learned to address those words from Dina, those tough words, right? Part of that was going into group therapy, where I started to talk with other people. And for the first time was sharing, I found the courage to share my vulnerabilities. And what I realized in that process, Marcus, is that I was helping people that hadn't even thought about some of the things that I was talking about. Now I'm like pretty young guy. I didn't think of myself as having any wisdom, right? This is just life experience. But I think the joy of seeing somebody who walked into that group session practically crying and seeing that woman laugh and smile brought incredible joy to me. And it's like, wow, there is something to what I'm going through. And so, I think I learned at a fairly young age that even though I had a career in high tech, in sales and marketing, right, that in the back of my mind, my purpose was really to help other people deal with challenges. And if I could instill something in them from my experience to help them along the way, there's nothing better than that. So I think that it renews. Well, renews probably not the right word. It helps you identify yourself as somebody that you're, I think, more proud of as a person. You feel better about yourself. I started to look back and say, if I had just gone down this track that I was on in college, where everything was easy, where would I be? I might be a lawyer doing something that was important. I don't know. Maybe I was making changes that were important to society. Maybe I wasn't, but I didn't think that I would have as much benefit as what I got from my experience about, the empathy that we gain when we experience something significantly difficult in our life, the gratitude, the perspective, the life perspective. It just helps put everything into an easier space. You start to look in the mirror and you say, I don't need to stress today. I've been through so much. I'm going to put it in perspective.
So, a couple of things. I'm going to read another part of your book. It's about making a choice each day to never indulge self pity and self doubt, but to fight and continue to seek the light. It's called resilience. Learning to adapt, bouncing back, and discovering you can grow from your experience with adversity is what resilience is all about. Post traumatic growth can give us a clear perspective and a greater appreciation for life and spiritual development. It becomes easier to find silver linings in every adversity. And I think, if I'm not mistaken, post-traumatic growth was Kazimierz Dabrowski, who was a Polish, I think, psychologist. But he had actually written a little bit about those who had experienced the Holocaust becoming better people as a result of it. And I found a lot of what you were saying echoed. But I'm going to go on and I'll land the plane here. But you referenced Martin Seligman. The question is, how do we change the way we look at adversity? It involves reframing. Let's say we have three beliefs about setbacks. Whenever a bad thing happens, it's our fault, number one. Number two, everything will always go wrong. And number three, setbacks will never end. Martin Seligman calls them the three Ps: personalization, pervasiveness, and permanence. Reframing means we look at events as impersonal and isolated incidents and temporary. So I only bring this up because I'm reading a book called Chatter by Ethan Kross, where he talks a little bit about the voices in your head. It's actually exclusively about the voices in your head. But what he does reference is the statistical benefit of journaling or reframing it from a third party or third person or second person perspective. So rather than saying, I went through this, I'm feeling bad about this, it's Terry went through this, Terry did this, he did this. And I started to experiment a little bit with it, and I found a lot of value in it.
Yeah.
And I'm just curious if you see the relationship in terms of the reframing in how you look at your own experience, because I have trouble ruminating. And that rumination, which is the chatter, continues to go on and on and on. But what that disallows is the ability to seek that perspective. And to me, a lot of what you reference as reframing seems like perspective related to what your involvement was, the fact that it can still be an isolated incident, even though you may have a series of isolated incidents that occur in short sequence. Anyway, I think you know where I'm going with this, but I'm curious how you view reframing.
Yeah, I mean, I think it's a lot about having that growth mindset, right? So instead of, looking at an incident, a challenge as why me, it's what can I learn from this? It's a completely different way of looking at what you're experiencing and opening yourself up. I think, reframing Seligman also talks a lot about, the fact that it's temporary, whatever's happening to you. This is not a permanent thing that's going to last forever. And if you can keep reminding yourself of that and think about that growth mindset of, well, there must be something here that I'm going to learn from. If you can believe that, that you'll end up in a better place. I think that that's really what life is all about anyway, right? I mean, we're all trying to grow. We want to grow. Our lives are changing. Our priorities change. That's why they talk about wisdom as something that older people have. And when you see a young soul with wisdom, you always wonder, God, where did that kid get that? But yeah, I mean, I think reframing is really important in terms of helping people out of their own way.
Yeah, I want to talk about getting out of your own way too, because you talk about liberation. And there's a scene in your book where you decided to go out for a run, and for the first time you took your shirt off to go on that jog. And I felt you. It was a really special thing to read, that you sort of lost track of time. You didn't notice anyone looking at you. And I think that was an analogy or a parallel to what you might have been experiencing professionally when you started to put yourself out there more. And you started talking about some of the work you were doing with Oracle and other high name clientele that exposed you to more and more business in your consulting world. And I think it's a Seinfeld joke, but they say that people are more fearful of public speaking than they are of death, which means that they would prefer to be giving the eulogy than they prefer to be in the casket than be giving the eulogy.
Yeah.
And I just sort of want to explore a little bit of what that means, because I think there's a direct correlation between that liberation and that vulnerability. Is maybe just the ownership of that vulnerability, or sort of just the letting it out there. You talk a little bit when your first book got released, how there are photographs in there, and you saw, I think, your first distribution, the box that you were opening it, and it was sort of dawning on you that there were photographs of what you went through just out there floating in the world. And there's a dauntingness. I mean, I can't relate to that, but there's a little bit of a dauntingness that I had when I started this podcast that, like, this is going to be out there in perpetuity.
Yeah.
Where do you, what advice, how did you find that vulnerability? People talk about it being courage, but I think there's more than just courage to confront it. It's actually willpower and discipline and a purpose. There's a why behind
Yeah.
that vulnerability. I might be wrong, but how
Absolutely.
do you find that? How would you encourage somebody to identify that liberation? And how has your life been different as a result of being able to
Yeah.
take your shirt off again?
Yeah, I mean, I think taking risk is a really important thing. Sometimes you just have to take a chance and take a risk, go with what your gut tells you. And I think that um, that sharing your vulnerabilities with people, quickly you begin to realize that everybody has some kind of a story, right? Sometimes you know people for many years and you don't really know deep down what might have happened to them because you guys have never had a conversation that goes deep, right? And so I mean I'm a big proponent of sharing with people, um, talking about asking questions, right? Asking people about themselves. People generally like to talk about themselves anyway, and when you can find common ground with an experience, it opens people up in ways that I think is really liberating, actually. And so I think that for me, finding the courage to be vulnerable, to share these things. I mean, I speak, all the time, and I share this story, and sometimes people are like shocked, like they're going, "Really, God? I mean, you don't look that bad, or you couldn't have looked that bad." And it's like, no, that's the way I felt, and so if I don't share with you exactly how I felt, then you're not really going to get my real story and understand how I was able to kind of come back because I took that risk. And one of the most liberating moments um, and transforming events was spending that time with other people that I didn't even know, Marcus. And I think this is really important. I'm just going to touch on it for a second. I talked about support from family and friends and how important that is. Finding your support system, people that you trust, is really important. But there's one downside to it, right? When you're going through something difficult, a lot of times your closest allies will come to you and say, "Oh, you're great. You're so strong. You're going to be fine," right? They say these kind of things that are positive, and maybe they make you feel better. But for me anyway, I started to question, like, well, of course they're going to say that. This is my family. But when you go to an environment like a support group where you don't know any of these people and they're honest, they share honest feelings with you. And that to me was really, really amazing, an amazing growth experience because it was connecting with people on a whole different level and helping me really understand where I needed to spend time working on myself, right? Um, God, I didn't know I was that insecure. Really? I'm that insecure? And thank God that I got those messages because as that's what enables you to have success in your life. You have to have self-confidence. You got to feel good about yourself or your life is going to be pretty difficult.
I keep going back to this, but how do you find that? And as I'm thinking about vulnerability, I think the fear of being vulnerable stems from, in large part, the fear of being judged.
Yeah.
And that fear of being judged is directly connected to an insecurity. Um, and that all has to do with intrinsic value versus external value. I mean, this is sort of a cyclical theme that I keep going back to. but there's that by virtue of being, and I sort of I can relate to that public, not public, but a different environment with where there's just a high degree of credibility because of the truth value that these people are giving. And I want to talk about family in a second, including the ones and friends and support system that were absent
Yeah.
and sort of the removal of that, because I think that's a really important thing to discuss. But as it relates to vulnerability and finding that courage, it's like you take that risk and you sort of identify greater security by virtue of taking that risk. You hope. How do you continue that momentum to actually climb out of the insecurity hole? I don't know if you ever really do, but maybe it's shallower or more easily overcomable. But what did you find effective in being able to not just put yourself into vulnerable situations within those groups, but even more publicly,
Yeah.
like in your consulting business, in your books, on camera? You've had multiple interviews on several networks. I'm curious how you what advice would you give to somebody that's going through their own crisis, or even better, how to build it from scratch
Yeah.
to sort of mitigate against the crisis?
Yeah. I mean, you alluded to this earlier that, when that first book came out, I didn't really anticipate the opportunities that might come from it because I didn't really think people would start calling me to present to them as in front of a large group of people. Because to your earlier point, I always felt like I'd be judged in front of a group of people. I didn't feel good about myself, and then that would just make me feel even worse if I didn't perform well in front of an audience. So I got laser focused when these opportunities started coming up. I told myself, I have to respond to this. I can't ignore this. This is an opportunity for me to share and grow in the process. And so for me, it was all about preparation. I was somebody that got super prepped, and that really helped build my confidence. So I think that's always, I share different examples of that in the book, right? But preparedness is really key. And I think that setting goals, single goals to say, this is a challenge I have to address. How am I going to go about it? What are the steps I'm going to take? And not getting overwhelmed by 5, 6, 7 goals or priorities, right? Because as I always say, it's like if you've got 5 priorities, you really don't have any, right? And that might be an exaggeration, but I'm much more about find the most pressing challenge, focus on that one. So that's kind of the approach that I took, and I think that really helped build my confidence back because it put me in a reactive situation where I said, "Hey, I've got to present in front of this group in a month. How am I going to present myself in a way that I'm going to feel good about myself? Because today I might not feel so good about myself." And that was great therapy for me, you know. So I combined it with other things too, right? Visualization's part of that process. But yeah, I don't know if that answers your question.
It does, but how would you maybe take it outside the uniqueness of your own situation relative to your speeches and consulting and apply it maybe to, yeah, I don't know, a teenager maybe fighting bullying, for
Yeah.
example, or something to that effect? Is there something more universal? How do you prepare for a bully fight? I mean, is there something else that you think would be helpful in those types of circumstances?
Yeah. Bullying is really, really tough, right? Because I see it, I hear about it, I watch it, and some of the things that happen are just incredibly brutal. And I think that uh, people generally have, you know, different approaches to how they want to deal with people that interact with them in a certain way. Some will just say, I'm going to ignore that and put that aside because I don't believe what they said, and I'm just going to focus on continuing on versus saying, well, maybe why am I the source of this? Why am I the recipient of this bullying? And is there something that I can learn from that? about myself. And and I think that if you reflect a little bit and think about maybe what's bringing that on, you can come up with uh, some ideas and some ways to better cope and handle that situation. So I'm big on reflection. I think that that's a huge thing. And I know that when you're young, maybe it's not quite as easy, but if you can just take an incident and step back from it and really kind of peel the onion back on it and try to figure out what actually transpired there. Um, why is this happening? What is there anything that I have control over? And those are the things I should focus on. If these are just people that do this to everybody, then I just have to ignore them. But maybe there's something that you can learn from it and act on. I mean, I'll tell you, just, to not to toot my own horn, but I worked on this so hard about rebuilding my confidence that what's amazing to me, Marcus, is that when I was in my 20s and I went to that party and there was a group of kids, with the parents, and the kids were staring at me uncomfortably, that was really difficult for me. It happened all the time. But you know what? As I got older and I got more confident with myself, that stopped. Like, I go into a Starbucks now and there's two kids with their mom. In the old days, those two kids would have been like pointing and like, Mom, like, help me understand. And today that never happens. Why does that never happen? Well, I actually could argue, Marcus, that I look worse, right? Because I'm balding, my scars are more visible, whatever, right? Um, the color of where I had radiation is more red, but it doesn't happen anymore. So it's all in how you carry yourself. So, I mean, there's no free lunch, right? You do have to work at it. And that's why I think, you talk about being a father and being so observant. And that's why I think parents are, they have a big role to play and to monitor this, because there's ways that you can help as well, for that child who might be struggling. If you're paying attention and you're alert and attentive to what's happening with your child, which is so important today. It's far more probably than it ever was, right? When I was growing up, you could play in the woods all day. My mother and
Yeah.
father never knew where I was, Nobody cared. They didn't have to. When they rang the
Yeah.
bell at 5:30 for dinner, I came home. It's a
Yeah.
different world.
So speaking of your parents, I think you do, and your brother, you talk a lot about their support, but I'm curious, something that really stood out to me was how silent some of the closer friends prior, to the diagnosis sort of vanished.
Yeah.
How they sort of weren't there. And, like, this is sort of, the silver lining in events like this to me, is because it really forces you to look at things that you might have otherwise viewed. Having gone through that, how do you advise people sort of trim the fat from their own life? How do you view, because I think it's absolutely critical in crisis
Yeah.
situations, but it's no less critical in your normal
Right.
day-to-day life, because I think it really sort of not only informs how you're viewing the world, but also how you perceive yourself, how you attack identity and purpose and your future. What do you advise people look for in those circumstances? And how do you advise them remove
Yeah.
themselves gracefully?
Yeah.
Because, burn bridges, I'm not a fan
No.
of. You don't want to hurt people's feelings, but at the same time, as you so clearly state, you got to put your own gas mask on
Yeah.
first, or your oxygen
Right.
mask on first.
Yeah. I'd say first and foremost, surround yourself with people that you trust, that make you feel good. That's really important. But there are toxic relationships too that aren't just things that you can ignore easily. You can't just say, oh, I'm just going to stay away from that person, because sometimes these other people have um, a personality type that is going to be very aggressive, and they're going to keep calling you and keep saying things to you that might not make you feel good. And so, um, not everybody wants to go to therapy, right? I'm not a therapist. I'm not a doctor. I didn't have the answers. So I did go to therapy over stuff that we're talking about right now to say, how do I deal with this kind of situation? And, what I learned is there's certain types of people that you'll never change them. They are who they are. And so you owe it to yourself to find what are the coping strategies that I'm going to use. And sometimes that's just limiting your involvement to the extent possible. Other times it's easier, right? This person that just says negative things all the time, it's just, you know what? I'm just not going to respond. I'm not going to meet them again. And they will get the point and they will disappear. And those are much easier, right? Not everything's that simple. So, uh, so yeah, it takes some work, but again, not like I said before, there's no free lunch. I mean, you do have to work at some of this stuff to make your life better. But I also say that even though it might sound like work, I think it's a gift at the end of the day because it enables you to live a healthier, happier, more purposeful life.
So, I can't help but think it's not just friends too, though. There's probably, and I don't want to put words in your mouth, but I am curious about this where, even family members who may not be outright negative. I mean, the outright negative people who may not be aggressive, it may not be family members, seems like the easiest of, or the most simple
Yeah.
to sort of extricate yourself from. But have you had to encounter maybe the more subtle uh, virus type, um, if not family member, close relationship where it's not quite so clear. You just sort of know that I don't feel right in this environment.
Yeah.
How have you successfully dealt with that?
Yeah, I think that that's one benefit of age, right? We start to have these common experiences over time. We say, this one feels different. This one doesn't feel right. This relationship is reminds me of something that I experienced a long time ago. So yeah, it's hard, and I think every situation uh, is a little bit different. To your point earlier, you always want to be kind. I think with yourself and with others, and find you know ways to extricate yourselves that don't create a difficult situation, an argument, a situation that becomes incredibly uncomfortable because that creates a lot of stress for you as well if you're a sensitive person. So yeah, I just work at it and try to understand the personality type. So I do a lot of homework, right? Because there are passive aggressive types that I dealt with all the time in my work life, right? Well, how do you deal with that, right? So that's sort of a different deal than somebody that might be, a complete narcissist that is impossible to deal with. And then there's the people that just are insensitive, that don't really, I don't think, have a grasp on really maybe what they're saying, and nor are they really cognizant or aware of. They're not really that present, right? And so those are people that I probably don't want to spend a lot of time with. How do I extricate myself from them? I find ways to do that by just, sort of removing myself slowly over time. And I think a lot of people get the idea and don't really have an issue with it.
Yeah. What ways do you think, what are you most proud of relative to who you are today that may not have existed when you were 20?
I think what I'm most proud of is really the person that I've become in terms of, I think I practice kindness constantly. I think that that's so important. I think that I think a lot about what people are going through because of what I went through. And though mine was visible, oftentimes it's invisible. And so don't judge, be kind, because no one really knows what's going on inside of other people. So I think, that's first and foremost, practice kind, I think is so important. And I think that, again, the blessing of what I went through helped me become more empathetic, helped me uh, really become somebody that had a lot of gratitude and just has a better life perspective. So I'm more willing to step out and help people when I can. So can I just tell a quick story?
Please.
So it's really funny. I mean, practice being kind, right? I was at a store where there's you fill up your water bottles. You go into these shops and it's water. You fill up your jugs and you take them home. So I'd go in there. I'd get my 3-gallon jug, put it in my car, and one day I do this, and here's a mom with her probably 13-year-old daughter, and they've got this cart that they're rolling, and they've got like 10 or 12 jugs of water, empty bottles, and I see them when I'm in there, and then when I come out to my car, I'm sitting on my phone going through email. So they finish, and it turns out they're right next to me, and they're trying to load this stuff in the car, and they are so frustrated. She can't lift it, all this stuff. Anyway, so I think to myself, okay, I'll just offer to help, right? So I offered to help, and so I helped them. It took me all of 2 minutes. It was no difficulty. And as I back up and as I'm driving away, the daughter's just like, thank you so much. Like somehow I made her day. And I thought, wow, that's just naturally just being kind to somebody that can't do something, doesn't have the capacity to do something. So just be aware of those kind of things that are out there because they
Yeah,
make you feel good too, right?
absolutely. Absolutely. There's a couple of other questions that I wanted to ask that I found myself wondering. Why in 1991 did you decide that was it? No more surgeries after 7 years. Was it just enough? Was it
It was
what happened at the
it
point?
was Dina's tough words, right? It was Dina saying, your issues are not your physical ones. Your issues are deep, and you need to recognize that. And that was literally the last procedure I had. That sixth procedure in Chicago. I didn't have any more. I mean, it wasn't an instant thing, Mark. It's not like I just stepped away and said, "All right, that's it. I'm done." But I reflected on it, and that was it. That was the turning point. That was the point at which I realized I could control my destiny by focusing on rebuilding what was inside instead of focusing on trying to be this guy that I used to be, which
Yeah,
takes us back to the beginning, right?
absolutely. And I had one other question about Dr. Z, who
Ah,
sort of stood out in my mind while you were telling the story. Who was a special doctor. I'm hoping you can give some context for him, but by virtue of what he did, he had to see several of his patients pass away. You talk about it in light of him having outlets and the like, but at least the perception I had about him was that he had an extraordinary bedside manner. He was a very kind and generous person. He could instill optimism without being false in what he said to you. Can you just talk about him a little
yeah,
bit? Because I sort of wanted to meet him from how you described him.
greatest guy in the world. He actually is nearing 80 now, and he called me about 6 months ago, sort of out of the blue. He saw something on LinkedIn. We had a great conversation. But yeah, Z was this incredible guy who arguably uh, was a guy that had vision in the tumor board meeting to realize that, hey, this could go a pretty dark way. I'm going to make sure that this kid has what he needs. So, number one, he pays attention, but he pays attention to patients, right? Right. So I'd go in there, and honestly, I was not in a good way because I had to go see him all the time because my denture had to be adjusted, had to be modified because tissue was shrinking from radiation. And he would just look at me and he'd size me up really quick and he'd go, Terry, you got to just chill out, man. Stop getting so worried about all this stuff. You're a 21-year-old guy. You got to live your life. I want you to go out and have beers with your buddies. Just live your life. And he knew I liked to play hoops, so he's like, let me build you a mask. Let me try to build something that provides support structure. But these are things that many doctors would never even consider thinking about, right? It's like, this wasn't even something that he had done before, but he improvised and he built me a mask. And but he really taught me about balance, and he really helped me think about outlets in my life and the importance of living, really. Because I kind of felt like I had gotten to a point where it really wasn't living. I was just coping with my surgeries and going from one surgery to the next with nothing else in between, Great guy.
Yeah. I love that story. Well, I appreciate you taking some time to talk with us today. I am enthusiastic about your book. I think there's a lot of value in it. I also think what you're doing by virtue of your vulnerability it's been many years, but I think there's something special about the book in what you're sharing. So that is an act of kindness on a greater scale. Just by virtue, I'm curious what your writing process is, to be honest. Has this been something that's been formulating for a while? Did you set a discipline where you were writing 30 minutes a day? Wait for your muse? How did you go about writing this?
Yeah, it was an interesting process. I would hear things. So I would do a presentation, I'd do a speaking engagement, and I would have people come up to me afterwards and say, hey, I read your book. So I know your personal story, and you talk about that, but you also talk about all these other tools and methods. You need to write a book about that, because that's what can help everybody else deal with their own challenge. And I heard that over and over again, but I was pretty laser focused on work during those years and just couldn't sit down to write it. So very different process this time. I finally when I left my job in high tech and said, I'm retiring. And that lasted about 2 months. And I said, now I can write this book. And the process really wasn't difficult, because I basically crafted a one-page outline, and then I just started pouring into it. And I was disciplined. Like, I would say, okay, I'm going to spend 2 hours a day of focused time on it. And sometimes it'd be more, sometimes it'd be less, but generally speaking, I'd hit at least 2 hours. So I had that discipline, but I just kind of let it flow, and it sort of worked itself out. And it's a very cathartic process, actually. So I enjoyed it.
I can imagine. Yeah. Well, thank you again for coming on. Thank you for sharing your story. Any closing thoughts or things you think we might have missed?
No, I just want to repeat something I might have said a couple of times, and it's just about, being aware, being alert, and being attentive to what's happening around you. Don't be oblivious. Pay attention to what people are saying and what's happening, and look around and take it in, because we don't have all the answers. And collectively, with other people's input, we can get some great inspiration. So that's what happened to me. And so I pass that on.
Great wisdom. Thank you, Terry.
Thank you so much.
Thanks for listening. For a detailed list of episodes and show notes, visit scalesofsuccesspodcast.com. If you found this conversation engaging, consider signing up for our newsletter, where we go even deeper on a weekly basis, sharing exclusive insights and actionable strategies that can help you in your own journey. We'd also appreciate if you subscribed, rated, or shared today's episode. It helps us to attract more illuminating guests, adding to the list of enlightening conversations we've had with New York Times bestsellers, producers, founders, CEOs, congressmen, and other independent thinkers who are challenging the status quo. You can also follow us for updates, extra content, and more insights from our guests. We hope to have you back again next week for another episode of Scales of Success. Scales of Success is an Edge West Capital production.